Did you know that every 65 seconds, someone in the United States develops Alzheimer's disease? This shocking statistic shows just how common this condition has become. In fact, by 2050, it's estimated that over 12 million people will be living with Alzheimer's in the US alone. Dementia doesn't just affect the individual, it impacts families and friends, often leading to emotional strain and confusion. But here's the good news: recognizing the early signs of dementia can make a difference. Many people overlook these signs, thinking they are just part of getting older. The truth is, early detection can help families plan for the future and find support. In this video, we'll explore 6 early signs of dementia that you should never ignore. From memory lapses to emotional changes, these symptoms are often silent but powerful indicators of a growing problem. We'll also share simple strategies to stay alert and proactive. By understanding these signs, you can help yourself or a loved one lead a healthier, happier life. So, stay tuned as we dive deep into the world of early dementia signs and learn how to recognize the signals before it's too late. Chapter 1: The Unseen Battle, Memory Lapses or Just Age? Memory loss is often dismissed as a normal part of getting older. But did you know that frequent memory lapses could be one of the earliest signs of dementia? Forgetting appointments, struggling to recall recent conversations, or repeating questions are small but critical signals. According to the Alzheimer's Association, over 5 million people in the US live with Alzheimer's disease, and many don't realize the symptoms until it's progressed. It's easy to brush off these lapses as just being forgetful. But here's an interesting fact: in a study from the Journal of Neurology, nearly 60% of people showing early memory loss had no idea it was tied to dementia. The brain's hippocampus, the area responsible for forming new memories, starts shrinking years before dementia fully sets in. A good strategy to stay alert to these changes is to track memory habits. Keeping a journal of instances where you forget things can help spot patterns. Also, make sure to engage in brain-boosting activities like puzzles or learning a new skill. Studies show that mentally challenging activities can reduce cognitive decline by up to 30%. Chapter 2: Mood Swings or Silent Warnings? Emotional changes you can't ignore. Not every sign of dementia starts with memory loss. In fact, emotional changes might be one of the first red flags. Sudden mood swings, irritability, or feelings of depression can signal early-stage dementia. According to The Lancet, emotional instability often surfaces years before more recognizable symptoms. Many families notice a change in behavior but chalk it up to stress or aging. Here's a key insight: early dementia often affects the frontal lobes of the brain, which control mood and decision-making. People may withdraw from social activities, seem confused by situations they used to handle easily, or become unusually anxious. A loved one might suddenly seem like a different person, but not understand why. This can be confusing, and worse, it's easy to ignore. So how can you tell if it's more than just a bad day? One strategy is to track changes in behavior over time. If a person seems more agitated or emotional for no clear reason, it's worth noting. Some experts suggest mindfulness techniques to help manage mood fluctuations and keep emotional health in check. Studies show that people practicing mindfulness had 47% less progression in dementia symptoms over 5 years compared to those who didn't. Chapter 3: Misplacing More Than Keys, Struggling with Spatial Awareness. It's common to misplace things every now and then. But when spatial awareness becomes an issue, like having difficulty navigating familiar routes, getting lost in a once familiar place, or even struggling with parking, it may be a warning sign of early dementia. This goes beyond forgetfulness. It's a problem with the brain's ability to process spatial and visual information. A study by the British Medical Journal found that 40% of people diagnosed with Alzheimer's had spatial issues as one of their first symptoms. One notable example is trouble judging distances, which can make driving risky. If you notice someone bumping into things more often or feeling disoriented in familiar places, it's worth paying attention. A simple way to test spatial awareness at home is to observe how well someone navigates a room or if they seem confused by physical spaces they once knew well. Staying physically active, particularly with exercises that involve coordination, like yoga or dancing, is shown to improve spatial memory. Research from Harvard Health shows that people who engaged in these activities saw a 20% improvement in their spatial abilities over 2 years. If you're finding this information helpful, don't forget to subscribe to our channel. We provide more insights into health and wellness topics that can help you and your loved ones. Chapter 4: Conversations in Circles, Repeating Stories Without Knowing It. Have you ever caught someone repeating the same story within a short span of time? We've all done it, but when it happens often, it could be an early sign of dementia. Repeating questions or stories can feel harmless, but it's a red flag when it becomes a habit. The Alzheimer's Society reports that this is one of the first indicators families notice. Repetition happens because the brain struggles to store new memories, so a person may not even realize they're repeating themselves. An interesting fact is that this memory issue is tied to a breakdown in the brain's ability to process short-term information. According to Dr. John Medina, author of Brain Rules, the brain starts working around what it doesn't know. This explains why people may fill in memory gaps with repetitive speech. A helpful strategy here is to approach the conversation with patience. Rather than pointing out that someone is repeating themselves, gently redirect the discussion or ask them questions to engage their memory in new ways. Studies have shown that repeating information in different contexts or engaging in new discussions can help strengthen memory recall. Active listening and conversation games, like word association, can also keep the brain sharp. Chapter 5, The Money Mistake Trap. When finances become confusing, managing finances is a complex task that requires clear thinking and organization. But when handling money becomes confusing or overwhelming, it could signal the onset of dementia. Struggling with paying bills, forgetting transactions, or making unusual purchases may be early symptoms. In fact, a study by Annals of Internal Medicine found that individuals with mild cognitive impairment are 50% more likely to make serious financial mistakes. One alarming statistic is that financial mismanagement often becomes noticeable up to 3 years before a dementia diagnosis. And yet, it's often overlooked because we assume it's just poor budgeting or carelessness. According to financial psychologist Brad Klontz, money is the canary in the coal mine. When we see problems with finances, it's often one of the earliest clues something isn't right. So, what can you do? One strategy is to monitor for unusual spending habits or difficulty with simple financial tasks, like balancing a checkbook. Having a trusted person help with oversight, whether through co-signing accounts or setting spending alerts, can provide a safety net. Additionally, mental exercises like budgeting practice and number games can help keep financial skills sharp. In fact, research shows that playing number-based games can improve cognitive function by 15%. Chapter 6, Silent Language. Trouble finding the right words. We all struggle to find the right word from time to time, but when it becomes a pattern, it could be more than just a senior moment. Early dementia can cause language difficulties, making it hard to name everyday objects or follow conversations. According to the National Institute on Aging, language problems are one of the first cognitive functions to decline in dementia patients. Here's an interesting fact: people with early dementia often describe it as having words on the tip of their tongue but never being able to grasp them. This is because the part of the brain that controls language, the left temporal lobe, is one of the first areas affected by Alzheimer's. In everyday life, this might look like calling a watch a hand clock or struggling to follow a fast-moving conversation. A strategy to help maintain language skills is engaging in regular reading and writing activities. According to Dr. Sanjay Gupta in his book Keep Sharp, the brain is like a muscle. The more you work it, the better it performs. He suggests crossword puzzles, word games, or simply reading out loud to improve language retention. Speech therapy can also be beneficial, even before severe symptoms arise, helping individuals stay connected through language. Thank you for joining us in this exploration of early dementia signs. If you found this video informative, please subscribe to our channel for more valuable health insights and tips for a longer, healthier life.